Hi, my name is Dr. Pedram. I've been practicing dentistry since 2003. We are at the beautiful location of 57 Portland Place, and I will be teaching advanced prosthodontics, in particular telescopic and attachment dentures, at the beautiful facility of MediMatch. In this video, I'll guide you through the step-by-step process of fabricating and fitting a telescopic denture, from initial impressions to final cementation. Let's begin. Imagine a patient presents with missing teeth, but they still have some well-positioned remaining teeth. In this case, a telescopic denture is an excellent treatment option. The first step is to take an impression and send it to the lab to create study models. These models help with treatment planning and provide a record of patient's preoperative condition. Step 1. First, we prepare the teeth for the inner crowns. Once the preparations are complete, we take an impression and send it to the laboratory to fabricate the inner crowns. Ensure to take an opposing impression. Step 2. Once the lab work is ready, we receive the inner crowns, a wax bite block, and a special trace. Now let's go through the next process. Start by trying in the inner crowns without cementing them. Check the fit and ensure good marginal adaptation. The inner crowns will be numbered for accurate repositioning and will have retention attachments to stay in place during the impression. Next, use the bite block to register the patient's bite. This step ensures the correct occlusion. Now take a pickup impression using the special tray. Once the impression is taken, send it back to the laboratory along with the bite registration. Step 3. Now the lab has provided the polished inner crowns, secondary crowns, and the frame tray-in, which are welded together. Start by placing the inner crowns onto the prepared teeth without cementing them. Then place the frame over the inner crowns to check the fit. If everything fits well, send it back to laboratory for processing. If adjustments are needed, provide instructions to the lab or take a new bite registration to refine the occlusion. Step 4. At this stage, the lab has completed the final acrylic denture framework. The inner crowns remain unchanged, but we will now cement them in place. Start by placing an inner crown into the frame and applying cement. The frame is essential to guide the inner crowns onto the prepared tooth with precision. Ensure that the frame is fully seated and fitted down completely before the cement sets. Once set, carefully remove the frame and repeat this process until all inner crowns are securely cemented in place. And that completes the process of fabricating and fitting a telescopic denture. Following these steps ensures accuracy, stability, and optimal function for the patient.